We believe we're going to impact every human in the world.
We are one-of-a-kind technology.
The caregivers and the patients can be our biggest allies.
Try to make the world a better place for the others.
So we can live our best lives longer.
It's a marathon, not a sprint, so celebrate the small wins that come along the way.
Own it, go big, and be generous.
Thank you for joining us tonight. Please scan the QR code on the screen to follow tonight's agenda. When the category before yours is called, please join us on the right of the stage in front of the finalist banner. Now to introduce our MCs for the night, our executive producers, Mark Goldstein, Matthew Holt, Chrissy Farr, and Dr. Daniel Kraft.
Welcome back to the 6th Annual Digital Health Award Show. By day, I'm a venture capitalist at a firm called Builders, but by night, I'm your award show host. And tonight, that's what I get to be. And I get to do it with these guys. This is our 6th year, and we are actually really fired up to do it. We began this journey at UCSF. We hosted events at the Chase Center, and then on UCSF campus. At our 3rd year, we came to health. And well, why are we here? Because health is where the buyers are. It's where the biggest, it's the best show. It's here in Las Vegas. And we've awarded over 400 companies to date. And this year, we've got another 30 coming up. Why this show? Well, there are many companies out there that say, hey, I've got the best product. Look at me. Look how amazing I am. But you know what? We felt there needed to be a third-party awards program to help out the deserving companies who really need to stand out, who deserve to stand out, sort of like the Academy Awards and the Oscars. And we felt like we needed an Oscars for healthcare. And all of the companies that you're going to hear from today were voted here by 1,000 judges. Well, what's new this year? We mixed things up. We've added new award categories, including dental health and food as medicine. We have a new award for the best digital health provider. And our emphasis is increasingly on 2 areas. It's our up-and-comers, and for those of you who joined us at 1 o'clock, you saw those hot new companies to watch. And for our best-in-class, and that's what we're going to be honoring today, these are the companies that have evidence, sales, impact, and are really making a difference out there, changing our world. Now about our event. This year we're bringing the excitement, and we call it a sort of a 3-ring circus to health. Our awards pavilion has over 65 companies in it. Our grand finale, which is where you're at today, right now, is going to last for 55 minutes, not 1 minute longer, because at 6 o'clock, we have our after party at Milo's. And everyone told us they want to celebrate with their peers. And so we're going to have a really good after party. So, here's a summary of what happened earlier today at our Rising Star event. All the companies today that are winners and that are finalists are all going to be wearing lays. They're going to get lays, and so when you go to the after party, you're going to see them there. So if someone's got a lay on, you want to congratulate them. So we're here for our best-in-class show. We're going to focus on some of our emerging innovation companies in something we called our Best Story series. So thanks for coming. We're in a great setting. We're excited to get going. And now I get to introduce you to my co-executive producers. First one is Stephen Klasko, who actually isn't here. He's the former president of Jefferson Health and a partner of General Catalyst. But last minute, he went off to Europe, so he sends his regrets. But the second one is very much here, and his name is Matthew Holt. He's the founder of, there he is. He's the founder of Health 2.0. He currently runs the healthcare blog, and he advises tons of startups. He's known for his deep industry connections, and he really has an unmatched understanding of people, stories, and the histories of digital health. He's been here since the beginning, and has a reputation of knowing every detail in the field. Second is Christy Farr. Christy Farr is a managing director of Mann & Phillips & Phillips, and she joined us for the first time this year as one of our executive producers. She's transitioned from venture capital into journalism, where she covered healthcare technology for major outlets, including CNBC and Reuters. Our final executive producer, and certainly not least, I'd like to introduce Dr. Daniel Kraft. He's a leading futurist and visionary in health innovation. And if you haven't attended one of his TED Talks, his NextMed Health conferences, well, now's the time. Get going. He has his conference that comes up in about 2 months. Daniel is an authority on what's next in healthcare, but also he's a source of inspiration of the shaping what's the future of what we're doing, the future of our industry. And he'll kick it off tonight and walk us through the submission process and what we went through judging. Daniel?
Thank you. Thank you very much, Mark. I'm Dr. Daniel Kraft. I'm the founder of Digital.Health and NextMed Health. Digital.Health, that's the website, easy to remember, is a platform and community featuring the award finalists, as well as over 3,500 digital health companies and solutions. And it's your place to find, share, and leverage the growing world of digital health across the care continuum. And NextMed Health is the evolution of exponential medicine, which I've been running as a community and platform exploring what's now near next in healthcare. Our NextMed Health is coming up December 10th through 13th in San Diego, so come join us at nextmed.health. Okay, so the Digital Health Awards process is pretty lengthy, competitive, and takes the work of hundreds of pre-vetted digital health expert volunteer judges to compete. The first step was from open submissions in which the companies from across the world submitted their solutions for evaluation. We received a record number of submissions this year in both tracks, over 1,250. So the questions that were posed to the startups were, what problems are you working to solve? What's your superpower? Who are your clinical customers and users? What are your clinical and customer validations? What regulatory approvals have been received or are in progress? And what cost savings and reimbursement mechanisms do you undertake? So after the submissions closed, the hard work really began for our judges, and they reviewed applications based on their level of differentiation, validation, customer traction, clinical impacts, and potential cost savings. And over 350 fantastic companies were selected as quarterfinalists. So a big thanks and shout out goes to our judges, who spent an incredible amount of valuable time, energy, and consideration putting to judges. So judges, if you're here, please stand up and give us a wave, and a huge thanks to the judges, many of them here. Thank you. Yay, judges. Tough job. It was a lot of work because these were a lot of amazing companies to go through. Okay, so from the quarterfinalists, the judges narrowed it down to our 140 plus finalists. At this stage, we had 10 finalist spotlight Zooms via spotlight sessions on Zoom, bringing together the finalists from across the world to have a conversation about what they're doing and the current trends in the space. Our sponsor, Avia, helped set the stage in each category, where the winners that were announced tonight were selected based on their impact, innovation, business model, evidence, and differentiation. So for an easy way to browse and learn about the stellar finalist companies and their solutions, click the QR code you'll see there on the screen, and you can explore them. You can also go to digital.health and look at them in depth. All right, let's get this party started with our first category. All right, our first category is consumer wellness. So this category, consumer wellness, celebrates digital health solutions that put the power of health management directly into the hands of consumers. These innovations are designed to help individuals take proactive steps to prevent conditions from developing or worsening, and ultimately empower people to live healthier lives. The finalists in this category exemplify the very best in consumer-driven healthcare, offering transformative tools that make a real difference in everyday wellness. And presenting this category will be Stephen Collens, CEO of Matter and our category champion. Over to you, Stephen.
Thank you, Daniel, and thanks to the executive producers and to the Digital Health Hub Foundation. I'm delighted to be here to represent Matter on this platform. Since we opened in 2015, we have supported more than 1,000 companies that have gone on to raise more than $5 billion to fuel their growth. So we've seen a lot of companies, and I can tell you that the companies that were part of this program that made it to this point in this process represent really the continuing evolution of digital health. They are harnessing advanced technologies to improve health and healthcare in novel ways. Congratulations to all of the finalists, and best of luck as we wrap this up. I would now like to introduce Josh Seidenfeld, who's the partner and chair of digital health at Cooley, who will announce our finalists and our winner.
All right, thank you. Thank you, Stephen. So happy to be here on the stage with all of you tonight. The 4 best-in-class finalists in this category are Ada Health, Aptar Digital Health, Solera Health, and Twin Health. And the big moment, the winner is Ada Health.
Ada.
Congratulations.
Woo. And accepting the award is Claire Noverall, co-founder and chief medical officer for Ada Health. Congratulations, Ada.
Meet Olivia, a 51-year-old woman experiencing irregular periods, vaginal dryness, and hot flashes. She decides to look to Ada for help. First, Olivia shares the symptom that's bothering her the most. Next, Ada asks Olivia questions about how long and how intensely she's been experiencing her symptoms. Once she's done, Ada provides a complete assessment of her symptoms with suggestions for what she might be experiencing, as well as the suggested level of care.
Okay, next up we have a brand new category that this year is not only new to us, but also to health, and this is dental health. So this category highlights pioneering solutions that are reshaping dental care, advancing oral health. That's really part of, overall systematic wellness. Now look, I've got British teeth from the 1960s. You also lost in powers, right? So the good news is that presenting this category is Mariya Filipova. She is the Care Convergence Catalyst and the managing director of a brand new fund, 4100DX, a dedicated oral systemic fund. Mariya.
Great, thank you, Matthew. And thank you to all the supporters of dental health. You could tell from the applause that there's quite a few of us out there in the audience, so thank you. We do live in exciting times, not only because there's a dental health category in the Digital Health Hub Awards, but also we live in convergent times where technology is allowing us to connect dots that we weren't able to connect before. And because of technology and because of platforms like this, we're able to connect mental health, dental health, to overall health. And when people ask me, Mariya, why dental health? I want you to think about 3 things. It's as simple as 1, 2, 3. 1, as in $1 trillion of the annual cost of the 5 chronic conditions with direct links to periodontal disease or gum disease. And as Matthew just showed us, gum disease is much more common than we could expect. These are diseases like diabetes, cardiovascular, dementia, oral cancer, preterm labor. We spend over $1 trillion on them. 2 is the percent of global healthcare spending that we spend on dental care. And according to the World Health Organization, 3 billion people are suffering from diagnosed dental health conditions. Yet, only 2% of total global healthcare spending goes to dental, and only 2% of healthcare investing, by the way, goes into dental. Hence, the need for a dental health award, hence the need for a dedicated Care Convergence fund. With that, I want to draw attention to the 10 brilliant finalists who have been working tirelessly in developing solutions to advance convergence of oral health into overall care. And all 10 of them deserve our support and recognition tonight. That said, 2 of those companies truly stood out. You'll hear more about them, and because this is the first year we're doing Dental Health Awards, these 2 companies actually get, in addition to an abundance of recognition and value from Dental Health, Digital Health Hub, they also get to join me, Mark Goldstein, and my co-host, Dr. Jonathan Levine, at a special edition of the Think Oral Health podcast tomorrow. Now, you might be asking yourself, who are those 2 lucky winners? To announce those 2 companies, I am beyond happy to invite to the stage Denise Marks, who is here to join me as a CFO of CareQuest Institute for Oral Health, and my dear friend and a Care Convergence champion as well. Denise, take it away.
Thank you so much, Mariya. I am truly honored to be here today to announce the finalist and make the award for the dental health track here today. These 10 finalists are Dental Monitoring, Diagnocat AI, Grin, Great Gums, OraQ, Auris DX, Overjet, Uptime Health, Videa Health, and Wesper. And now our innovation winner is Grin. And our best-in-class winner is Overjet.
All right, accepting.
Thank you.
All right, accepting these awards are Adam Schuloff, who is the co-founder and CEO of Grin, and Neil Hoover, who is the head of business development and partnerships for Overjet. Congratulations, gentlemen. Congratulations to the new category.
Grin is designed to enhance, not replace, human input. We help you make the most of your existing resources and workflows by adding a touch of technology. The Grin Scope leverages smartphone cameras to give the highest level of intraoral visibility, coupled with the AI-powered scan guide and real-time images analysis in the Grin app. This ensures patients always take and submit perfect scans.
Up next is a new category this year, food as medicine. And we introduced this category to spotlight the growing recognition that nutrition plays as a crucial role in preventing and managing chronic health conditions. These solutions go beyond traditional healthcare by using the power of food to improve well-being and treat illness, making nutrition an essential part of the health equation. Presenting this category will be Nancy Mastroianni, head of investors and networks, and the beloved queen of HLTH, who makes most of the stuff at this show behind the scenes happen. Queen.
I've never been a queen before. Hi, thank you all for coming. I really appreciate it. So first off, I'm thrilled to be here tonight to present the Food as Medicine category, which highlights the incredible impact of food and beverage on our health and are promoting healthier lifestyles and supporting the prevention and management of chronic diseases. And now I would love to introduce Shrey, who is with the Senior Strategist of the Digital Healthcare Sysmex R&D Center Americas, and who will be announcing the finalists of the inaugural Foodist Category Award. Come on up.
Thanks, Nancy. Thanks, everyone. Really pleased to be here and sponsor the inaugural category for Food as Medicine, and glad to be joined by two of my esteemed colleagues in the corner there. Please say hi. So, yeah. Let's announce some of the 10 finalists in this category. So we got About Fresh, Bite Well, Eat Love, Farmbox RX, Mend, Nourish, Nourished RX, NutriSense, Olipop, and Pack Health. Okay, we'll do a pseudo drum roll. Yeah. And the winners are Nourish and NutriSense.
Accepting the award are Aidan Diwar, co-founder and CEO of Nourish, and Dan Devadri, co-founder and CEO of NutriSense.
Thank you, guys.
Appreciate it.
Hi, I'm Aidan Dewar, and I'm the co-founder and CEO of Nourish. Nourish is on a mission to improve people's health by making it easy to eat well. Our Food as Medicine platform helps patients improve their nutrition by connecting them with registered dietitians, software to improve their nutrition, and medically tailored meals, all covered by health insurance. Nourish's superpower is our unique blend of technology, nutrition guidance from registered dietitians, and access to medically tailored meals.
Before coming to NutriSense, Jo had been living with daily fatigue. She did her best to manage her symptoms, trying various diets and visiting various practitioners looking for an answer. But she continued to experience fatigue and energy swings and had trouble sleeping at night. When Jo joined our program, she was paired with Heather, a registered dietitian whose specialties matched her specific wellness concerns, nor the needs of her unique body and lifestyle. The NutriSense program gives you both insights into your body and expert guidance with your personal dietitian and will help you get to your health goals.
Why didn't the doctor believe me? Did I say something wrong?
Do we have to experience the same pain and bias as our parents and grandparents? What if they actually gave us access to those clinical studies we learned about and those cutting-edge medicines?
What if we ask the bigger questions? People of color still do not receive equal access to healthcare. We're determined to change this. Join us.
All right. So next up, as just on the ad, we have Health Equity, sponsored by our friends at Genentech, who are returning for the second year to sponsor these awards. Look, it's no surprise, right? Our healthcare system is confusing, it's expensive, it's unsafe. It's also deeply, deeply inequitable. It's just unfair. But today, we're going to celebrate brilliant ideas and companies that are really working to help the underserved, rather than just perhaps trying to make Silicon Valley billionaires live forever. Each company that applied is moving population health, social determinants, and health equity from sort of philosophy to the mainstream of clinical care. So in my book, they are all winners. And presenting this award is Greg Talbot. Greg is the head of transactions and digital health partnering at Genentech. Greg, thanks for sponsoring it.
Great. Thank you very much. I am thrilled to be here for the second year in a row presenting the award for health equity. It's Genentech's second year sponsoring it, and as many of you may know, not just from that video, we spend a great deal of time thinking about health equity and incorporating it into everything we do, whether it's conducting clinical trials on underrepresented populations or using data from underrepresented populations to discover drugs specifically for them. But we realize that this is a systemic problem and something that we have to solve across the entire ecosystem. So I'm thrilled to be here and to congratulate the companies that have already in this category begun making an impact for bettering health equity across the ecosystem and will continue to do so in the future. With that, I'd like to introduce Linda Finkel, CEO of Avia, to present the awards.
Well, if you know me, or if you know Avia, you likely know that there is no category for which I would be more excited about announcing the awards than health equity. So let me begin by acknowledging the 4 best-in-class finalists in this category. iPlato, Huma Company, Homeward, Sword Health, and Uno Health. And I'm delighted to announce that the winner this year is Homeward.
All right, accepting this award is Jeff Ross. He's the SVP of Value-Based Care Strategy and Contracting at Homeward.
Our job at Homeward is to improve delivery of healthcare in rural America. And it's really important to understand who you're serving when you're changing the healthcare ecosystem. And it's very personal for me. Each small town is not the same. Rural America is not the same everywhere. What we have to do is really deeply understand the people that we're serving in this small town feel. So what we decided to do is change the system and re-architect the way that we deliver healthcare in these areas.
Just to let you know, that was Dr. Jenny Snyder, the CEO of Homeward, and also importantly, the bar is open at the back, so feel free to go have a beer.
The home health diagnostics category recognizes the most impactful digital health solutions designed for in-home patient monitoring and diagnostics. To many, it epitomizes what digital health is bringing to the overall health equation, bringing diagnostic tools directly into the comfort of patients' homes. Care has shifted finally from hospitals to homes, enabling more continuous, personalized, and proactive health management. These innovations are transforming everyday spaces into hubs of healthcare and empowering individuals to take charge of their lives. And it's really happening, and you can just feel it at the show today. Now, I'd like to introduce Murray Brzezinski. He's a partner at Aegis Ventures and former CEO at Conversa, who'll be presenting the winner. Murray.
Thank you, Mark, and thanks to all the executive producers here. I'm thrilled to be here with all of the change makers at the Digital Health Awards, and I'm very excited to present this year's winner on behalf of Aegis Ventures. So Aegis it's a new kind of studio. We are creating the next generation of health technology companies. We're doing it in collaboration with health systems and powered by AI. So we've got a consortium of 12 leading health systems around the country. We have 5 super innovative portfolio companies. We are now on the hunt for our next cohort, and I invite you all to come over to the pavilion and visit us. Before I joined Aegis, I was running Conversa Health, and I had the honor of accepting this award in this category on behalf of Conversa. And having the relationship with Digital Health Awards and the foundation was a real boon to our business, and I'm sure it will be for all the participants here today. I feel like all the categories are super important, but obviously I'm very partial to this one. They say that home is where the heart is. Unfortunately, when we're sick, too often we find our heart in the hospital, and all the companies in this category have been working diligently to make sure that we have a future where the heart is mostly found at home. And so I'd like to congratulate all the finalists. Adherium, Constant Therapy Health, Healthy.io, Withings, and Validic. And I'd like to pass the torch to this year's winner, Healthy.io. Congratulations.
And accepting the award for Healthy.io is Becca LaFond, who's their general manager.
Life moves at its own pace. Healthcare isn't always in sync. Healthy.io empowers people to transform minutes in their daily routine into meaningful healthcare moments. We turn the smartphone camera into a medical device by syncing healthcare with the speed of life.
Diagnostics may be one of the most challenging corners of the health tech world, but is also one of the most impactful. So the companies in this category creating both hardware and software that provider offices are already using today for everything from vascular care, heart failure detection, and more. And introducing this segment is our champion, Paul Grand, who also serves as the CEO of MedTech Innovator. Welcome, Paul.
Thank you, Chrissy, and great being here. I've been involved with this since almost the very beginning. I guess year 2, Mark asked me to be part of this. And this is the first time I've actually been able to be here in person, so thrilled to be here. I was both an entrepreneur by training and then also a venture capitalist for 12 years, so I know what it's like to always be out there looking for money and how hard that is. It's very difficult. And the companies that are really, we're celebrating here today are just so incredible. We are literally the world's largest healthcare accelerator at MedTech Innovator. We've graduated 600 companies. This year we have another 100 companies about to graduate. Our companies have brought over 350 regulated products to market. So we know a little bit about innovation and about how hard it is to do this. As the world's largest accelerator, we see more diagnostics, I think, than anybody else on the planet. Executed successfully, diagnostics that are in the provider space can predict problems before they happen. They provide the confidence to move patients to lower acuity settings, and they address provider workflow reductions, which we all know is a massive problem. These are the key technologies truly to delivering precision medicine, to lowering costs, improving outcomes. These companies deserve our recognition like we're doing here today, and that's really important, but most importantly, they deserve your support. So please seek all of these companies out, regardless of who wins. These are really, truly the best of the best companies. Here to announce our best-in-class winner is Dr. Ken Tronner, MD, Chief Innovation Officer at the Permanente Medical Group. So Ken.
Thank you, Paul. I'm thrilled to be presenting this on behalf of the Permanente Medical Group, and as a provider, this is a very important category to us all. And so the finalists in this category are AI Doc, Flosonics Medical, Rapid AI, and Ultromics. And the winner is Flosonics.
Flosonics. Woo!
Accepting this award is Dr. John Emil Kenny, Chief Medical Officer.
FlowPatch adheres to the neck and assesses the carotid artery Doppler pulse. Since changes in carotid Doppler reflect changes in stroke volume, FlowPatch gives clinicians a window into the left ventricle and helps determine whether IV fluids will have the desired effect. FlowPatch's compact, user-friendly design helps clinicians make more objective decisions about fluid administration early and often throughout the continuum of care, especially in patients with sepsis and septic shock.
In healthcare, one idea can change millions of lives. But too often, tech barriers hold innovations back. What if we could accelerate ideas by bringing applications and insights directly to the point of care? Meet Vim's SDK and developer platform that unlocks access to EHRs, payers, and millions of patients with one build. For developers, it means the freedom to focus on creation, not IT hurdles. For providers, it's innovation at their fingertips, right in the EHR. And for their patients, it's access to care that's smarter, faster, and more personalized than ever before. Join VIM's virtually integrated healthcare network and start building today. VIM's developer platform. Build your innovation once. Deploy everywhere with VIM.
All right, our next category is Kids Health. So I'm trained in medicine and pediatrics, and fellowship trained in pediatric hematology oncology, and the father of 3, so I'm deeply passionate about advancing digital health solutions for our children, our collective future. Early interventions during childhood can shape lifelong health outcomes, making this category really important and impactful, because as we know, kids aren't just small adults, and effective solutions must be thoughtfully integrated into the daily lives of families, pediatric practices, schools, and communities. So this category celebrates innovations designed specifically for the unique needs of growing children, aiming to support healthier lives from the very start. And presenting this category will be Rebecca Torrance, correspondent, healthcare startups and VC at Business Insider. Over to you, Rebecca.
Thank you so much, Daniel. Hi, everyone. My name is Rebecca Torrance, and I lead Business Insider's coverage of healthcare startups and venture capital. I have the distinct pleasure in my role of getting to meet the most fascinating people across healthcare and find the most compelling stories. And there is certainly no shortage of compelling stories to tell and problems to solve in pediatric health. Clinicians are confronting a youth mental health crisis, the increasing prevalence of chronic conditions like diabetes and obesity, disparities in care quality and access, etc. Each of today's finalists is using technology to get better care faster to the youngest and most vulnerable among us. And announcing our best-in-class winner is Dr. Travis Gales, Chief Health Officer of Hazel, our 2023 best-in-class winner and our 2024 Winner's Circle sponsor.
I'm so pleased to be here tonight to honor our winner. The 4 best-in-class finalists in this category are Augment Therapy, Bend Health, GoCheck Kids, and QT Medical. And the winner is GoCheck Kids.
And accepting this award is Jordan Miller, VP of Customer Growth at GoCheck Kids. Congratulations.
Technology was pivotal for AJ's diagnosis and prognosis. And we absolutely attribute the good prognosis that we've gotten out of this because of that initial check that we had at the pediatric office.
I got a call from Dr. Oliver, and he was saying, I don't know what you guys did over there, but you pretty much saved this little boy's vision.
Longevity. Look, earlier on I was criticizing those Silicon Valley billionaire types who want to live forever and die on Mars. We probably all have our own selection of which particular billionaire we want to send to Mars right now. But there is a lot to be said for improving the health of those of us who might be, I don't know, closer to the finish line than the starting line. So presenting this category is Amelia Hay. She is the VP in the Startup Programming Investments at the Age Tech Collaborative, which comes from ARP, which is our category sponsor. I'm not only introducing it, I'm a member.
Thank you, Matthew. Wow. This has truly been an impressive showing of innovative longevity solutions. As an organization dedicated to older adults, we're delighted to see technologies that support this important and fast-growing segment of the population. These companies are poised to seize this multi-trillion-dollar opportunity. And now, announcing our winners is Hidekazu Ishida, Head of Corporate Venture Investment Office at Eisai Company Limited.
Thank you very much. I'm Hide from Eisai CBC function, and I'm so pleased to be here tonight. The 4 best-in-class finalists in this category are CarePredict, Intuition Robotics, Linus Health, and Cohere Health. And the winner is Linus Health.
All right, accepting this award is David Bates. He's the co-founder and CEO of Linus Health. Congratulations, David.
Linus Health is bringing a new approach to brain health. Our digital platform augments human expertise with cutting-edge AI to help healthcare organizations catch cognitive issues early and efficiently, then turn insights into action. The platform modernizes long-established paper-based tests with a fully digital solution.
Next is one of our most vital categories, mental health. The pandemic highlighted just how widespread depression, anxiety, and other serious mental health challenges have become across all segments of society. With a shortage of therapists and a limited treatment options, innovative solutions are more critical than ever. The companies in this category are stepping up, using telehealth and scalable care platforms to deliver accessible, personalized, and impactful mental health support to millions, transforming the way we approach mental and behavioral care. Salome Tibabu, founder and CEO of Behavioral Health Tech, and our category champion, had to leave unexpectedly after her Rising Star presentation today. So I would like to introduce Masayuki Minataka, project lead for Nito Denko Corporation.
Thank you. Thank you, Christy. My name is, hello everyone. My name is Masa from Nito Denko Corporation. I'm so pleased to be here tonight to announce best in class finalists in this mental behavioral health category and the winners. So the finalists are Equip, Neuroflow, Osmine, Kubitech, Spring Health. And the winner is Neuroflow. Congratulations.
Accepting this award is Chris Malaro, co-founder and CEO.
It all began in 1918. Since then, the Nito Group has contributed to a sustainable global environment and an enriched human society. We do this as a high-performance materials manufacturer. Our mission is to contribute to our customers' value creation with innovative ideas. Aimed at this realization, our vision is creating wonders. Each and every employee strives to amaze and inspire, aiming to be a driving force that changes the world in various fields.
Okay, up next is the women's health category, which shines a spotlight on digital health innovations specifically designed to address the unique health needs of women. So as we look at this category, we have an impressive batch. And for far too long, women's health has been underrepresented in healthcare solutions, but the companies in this category are changing that narrative. From reproductive health to menopause and beyond, these solutions are providing tailored, proactive care that empowers women to take charge of their well-being throughout every stage of life. And presenting this category is our category champion, Dr. Brittany Barreto, founder and chief innovation officer of Fem Health Insights and host of the FemTech Focus podcast. Brittany.
Hello, thank you so much. It is an honor to be here and present the Digital Health Award for Women's Health. The progress of FemTech companies continues to be nothing short of remarkable. These companies are leading the charge in advancing and addressing the unique needs of females, women, and girls everywhere. And they are impacting all aspects of healthcare, whether that be AI, mental health, longevity, across the full spectrum. Femtech is not just an emerging sector, but it's also a driving force that is redefining what healthcare means for everybody. It's a privilege to celebrate the groundbreaking work of these innovators who are shaping the future of women's health and, in doing so, improving healthcare for everybody. I'd like to introduce Lisa Hoover, Senior Consultant at Russell Reynolds Associates, who will be announcing our finalists and our winner. Lisa.
Thank you, Brittany. Thrilled to be here. So the 6 best-in-class finalists for this category are Ember Labs, Kind Body, Mira, Nest Collaborative, Aura, and Paragen. And the winner is Aura.
And accepting the award for Aura is Kristen Messina, Communications Manager for Aura. I've got my ring on.
The ring helps me interpret what's going on. There's certain things we really know about pregnancy. There's certain things we really know about menstruation. But like, there are other pieces that we just really don't touch as a society very much at all and talk about or do a lot of research in. And just having those tools and resources is something that gave me a sense of control, and I want other people to have as well.
Hi, this is our first time award, and it's because we decided that it was time to actually really honor not just ourselves as the companies, but actually our buyers. So this is the first time we have an award, and it's for the best digital health provider. And it's just to honor our best customers and their vision, their pioneering spirit, and the risk-taking they're taking to promote and add digital health solutions to legacy processes and in-person visits. Guys, it's finally happening. We've been here for years at HLTH, and we struggled to get basically provider adoption. We're really getting it, and it's time to now honor those providers that are taking on the risks. Across the country, great providers including Northwell, Cedars Mount Sinai, and Geisinger have gotten a lot of the credit, and they deserve it. They were pioneers. But our first winner isn't either of those. Our first winner, drumroll, is UC Davis. UC Davis has long spearheaded and promoted digital health, not only here at HLTH and elsewhere, but adopted many solutions before others. And it's time to basically raise our providers on a platter and thank them, because without them, we ain't going anywhere. And they are making a difference. And accepting for UC Davis is their Chief Executive Officer of UC Davis Health and the Vice Chancellor of Human Health Sciences, and a true digital health visionary himself, David Lubarsky. David?
Well, thank you. I'm happy to accept this award on behalf of an amazing C-suite and IT group that has pushed us forward. We've got about 52 working AI products in our organization already, 18 more clinical ones under investigation, and we are super excited. I've heard about a bunch of companies I don't even know about, but we'll be looking into it. That's what's so great about these awards. Thank you so much for recognizing this. Okay, so I really just want to say that we're really, really happy to be here. We're really happy to be here because I see so many super smart people out there in the audience. You guys are doing a great job solving the problems, and we're really looking forward to having 100 or 200 applications in place in the next year. So yeah, we actually want you to sell to us.
If you haven't seen what they're building at UC Davis, they are building a facility and is so digital health centric. And if we could have 50, 100 of those facilities across the country, we would have another 20,000 unicorns in this room. And if it wasn't for people like David, our industry wasn't going anywhere, and we really want to congratulate you.
Yeah, I mean, every single day, Mark, we're actually saving lives with the AI programs that we have in place. I know AI Doc was one of the ones you mentioned earlier. You know, we're working with them. We are taking care, we are reducing stroke deaths. We are reducing PE deaths. We are reducing sepsis deaths. We have really great statistics. We're saving money right and left, and we're actually making money on programs that say monitor for aortic aneurysms and their trajectory, because no one is falling through the cracks and everybody's getting their CT on time, and well, actually CTs pay for themselves. So everybody's winning. It's fantastic.
And you'll see what they're building in Sacramento and in Davis is inspirational to us all. Thank you, David. Thank you so much.
Thank you.
So we're going to go to our next award. Look, stories are everything, and he's a famous storyteller. But we decided to really push and emphasize stories. We wanted to focus on more than just the solutions here, but on the actual stories where the solution is making a difference at the payer, at the provider, and how many people are directly impacted, and how much money it's saving the institution. As we know, in 2024, cost savings in AI, these are more than buzzwords, but this is where all of our attention is going. So, for the first time ever, we have our biggest healthcare savings story, and appropriately presenting this category, David, you got to come back now. Appropriately presenting this category is David Lebarsky. David, come on back on stage.
So, thanks, Mark. It's an honor to present this category tonight. There are so many financial pressures on providers today. Rising labor costs, ever more scrutiny on rule following, and payers' refusal to pay legitimate bills. Healthcare systems are at a crossroads, so we're all looking for companies like the ones here to help forge a future where we can afford to take good care of both you and your children and your parents. Now, I'm pleased to honor some of the outstanding companies that have found ways to efficiently and cost-effectively improve care delivery. The 8 finalists in this category are Seidenfeld, Included Health, Hello Heart, Kina Health, NOCD, NOCD, Sesame, Syllable, and Ursheet Health. Yay, let's hear applause, yeah, for the group. And the winner is Seidenfeld.
And accepting the award for Seidenfeld is Ajay Shah, our CEO.
Overall, our team has now tested over 6,000 patients using IntelliSep who were at high risk for sepsis in the emergency department. This has transformed the way we think about our care delivery. At current pace, with utilization of the test, we are screening 500 patients to save 1 life.
Excellent. Well, Ajay, congratulations. And next we have, and we're coming near the end here, next we have our best AI healthcare win savings. So we thought about it's not best AI product, it's our best AI healthcare win savings. And we challenged the companies to work with their providers to come up with a story and said, who is out there making the biggest difference? Give us numbers, give us patience, and tell us where AI is really making the change, not all the buzzwords we're all hearing about. Well, we had probably 200 companies apply for this category. It was incredibly competitive, as you can imagine. And we came down to a number of winners. But presenting this category is Oren Afek, CEO of Vim, one of our sponsors.
Thanks, Mark and team, for having us. What we do at VIM is taking the 10-year of experience we have in this marketplace to bring most of the national payers and large risk-bearing entities in terms of their data and other rules engine access and so on and so forth, immersing this data and putting it inside clinical workflows. The idea is really to allow companies to build on top of now close to 10,000 practices, small practices, getting access to both clinical workflow across most EHRs, as well as getting access to data from payers. We think it's critical for AI. AI has a huge promise to reduce cost and do other amazing things for our system. But unless we can really bring payer provider together, align reimbursement, risk, priorities to really support decision support that is actually gets reimbursed properly, I think we're going to continue to struggle with another nice tool to have in a quiver. So the idea is really to bring those things together in a productive way, and that's what we do with many different developers, some of them sitting here in the crowd. So thanks for the opportunity. I would love to introduce Ursheet Parikh. He is a partner at Mayfield. They've been a huge partner for the foundation since the inception, and as a charter director and a key thought leader. So I'll have to introduce.
Thanks, Warren. It's good to be back here with all of you. It's just amazing to see how Mark's idea has become such an amazing event and institution. Anyway, at Mayfield Fund, we are all in for AI teammates in healthcare. We see it as a $1 trillion opportunity. Many startups of this generation will become enduring AI teammates for physicians, nurses, various providers, as well as for all the administrative and the revenue tasks as well. So it's delightful to see the impact. It's delightful to see the real stories that our various innovators have enabled. The 8 finalists in this category are Appella, Artera, Augmedix, Cohere Health, Limbic, Rad AI, Swift Medical, and Solis. And the winner is Cohere Health.
All right. And accepting the award for Cohere Health is John Gaines, their VP of Marketing. Congratulations, John.
Thanks, John.
We turn prior auth from a transaction to a collaboration between the patient's health plan and providers, resulting in faster, safer, better care. Cohere supports over 15 million plan members. We process more than 9 million authorization requests annually, and over 450,000 providers use our technology.
Well, that's it. We wanted to end on time. We have our after party that has started 5 minutes ago. So once again, I'd like to, on behalf of all my executive producers who will come up right now, I'd like to congratulate all the finalists and the winners. You guys are shaping the future of healthcare technology. So again, also thank our sponsors, other producers, the foundation team for making this event possible. This award program grows every year, and we're making sure that we can become the Oscars of healthcare. And also, I'd like to now welcome our VP of Marketing, Melissa Faulkner, also to the stage.
Thank you, everyone. We're so pleased to have all of you here tonight and honor all of our Rising Stars and Best in Class and Emerging Innovation and Best Story Series winners. At this time, I would like to invite the rest of the foundation team up to the stage. We definitely cannot do what we do to honor all of you without all of the wonderful people joining us on stage. Give everybody a round of applause. And now it is time to party. We invite all of you to join us over at Milo's. Right in front of the entrance to the convention center. Just follow the stickers that are hopefully on the ground so we can toast to all of you and today's achievements. Give a big hug to everyone wearing a lei. Yellow are winners and blues are finalists. See you there. And in Petunia, we'd love to have you come up on stage for a photo with us.